Welcome to Infection and Immunity Evidence Explained, a Doherty Institute podcast. I'm Rebecca Elliott. World Hepatitis Day, commemorated on the 28th of July each year, is just around the corner and aims to raise awareness of the virus that's responsible for more than 1 million deaths a year. The theme for World Hepatitis Day 2024 is It's Time for Action, a call to action to eliminate hepatitis by 2030. Here to tell us about the A to E of hepatitis is Professor Peter Revill, Head of Regional and Global Health at the Victorian Infectious Diseases Reference Laboratory and Head of International Research Partnerships at the Doherty Institute. Peter is an internationally recognised expert on hepatitis B, who together with colleagues established the International Coalition to Eliminate Hepatitis B. Peter, welcome to Infection and Immunity Evidence Explained.
Thank you, Rebecca. I'm delighted to be here.
Firstly, can you tell me, what is hepatitis?
Well, hepatitis is actually inflammation of the liver. If untreated, it can lead to serious complications such as liver cancer, and it can be caused by a number of factors such as obesity or excessive alcohol use or virus infection, which is what we're here to talk about today. And it's interesting, there's the Greek derivation of the word hepa means liver and itis means inflammation, so inflammation of the liver.
As you mentioned, today we're going to be talking about viral hepatitis, and in the introduction I mentioned the A to E of hepatitis. Can you please explain the differences in these strains?
Yeah, certainly. Look, they're completely different viruses that are transmitted in different ways, but they all cause hepatitis, if you like. So, as examples, hepatitis A and E are transmitted through the fecal-oral route and result in what we know as food poisoning, as well as liver inflammation. Whereas hepatitis B, C and D are bloodborne viruses that are transmitted through the exchange of blood and some other bodily fluids such as semen, but all affect the liver, hence they're known as hepatitis viruses, cause that inflammation of the liver.
And what are the most common strains?
Well, worldwide, hepatitis B, which is the virus I work mostly on, is the most common form of viral hepatitis worldwide from a chronic disease perspective, with more than 250 million people living with chronic hepatitis B infection. In fact, work in Australia done by the WHO Collaborating Centre for Viral Hepatitis, located here at Vigil at the Doherty Institute, shows that chronic hepatitis B affects more than 220,000 people in Australia at present.
That's extraordinary. And as you are an expert on hepatitis B, and for the purpose of this podcast, we will focus on this strain. So how is it transmitted?
Well, hepatitis B is a bloodborne virus, so it's mainly transmitted in blood, but it is also transmitted in semen through unsafe sex. It can also be transmitted through unsafe use of needles. But in fact, the most common method of transmission globally is from mother to baby shortly after childbirth. However, we're fortunate to have an amazing preventative vaccine that, if it's given to the newborn babies within 24 hours of birth, almost completely eliminates the risk of transmission or infection. Importantly, this vaccine, which is readily available, protects adults from infections too. It's important to mention, I think, that HBV is not transmitted by kissing, it's not transmitted by sharing food, and it's not transmitted in breast milk.
If you have this vaccine at birth, it gives you protection for life, is that correct?
Yes, yeah, and adults can have it too. So I've had the vaccine, and I work on hepatitis B in the lab, and I have lifetime immunity. So it's one of the most effective vaccines, I think, going around. In fact, it was probably the first anti-cancer vaccine in a sense, because hepatitis B causes 40% of all liver cancers. So it's a wonderful vaccine. But it's preventative, it's not therapeutic. It doesn't treat people who live with chronic hepatitis B.
And we'll get to treatments in a moment. But firstly, who is most at risk of contracting hepatitis B?
Yeah, well, it's important to point out that most adults who receive a Hep B infection will naturally clear the infection due to a strong immune response. And people who are unvaccinated but have an intimate relationship with a person living with chronic Hep B should be vaccinated to protect themselves from contracting hepatitis B. But I would argue that we should all be vaccinated. It's a safe and highly effective vaccine that provides lifelong protection.
And if we do contract hepatitis B, what are the main symptoms?
Well, often there are no symptoms at all. Many people with chronic hepatitis B, which is defined as an infection that persists for at least 6 months, may have had the virus since birth or early childhood and do not experience symptoms, or at least not aware of any symptoms they experience as abnormal. And the symptoms may differ in severity and intensity over time. But in severe cases, and look, I'm not a doctor, but I know this, that in severe cases, hepatitis B can cause abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, and weakness and fatigue. And also yellowing of the skin and whites of the eyes, which is, jaundice, if you like.
And just how severe can it be?
Well, in severe cases, as I mentioned earlier, it can progress to liver cancer. Now, if people are receiving treatment, that's a lot less likely. But if people are untreated, it can progress to liver cancer. And as I said, it causes 40% of all liver cancers.
So how is hepatitis B treated?
Well, Rebecca, we're really fortunate to have antiviral drugs that suppress the virus so that it can no longer cause disease. But this requires taking a daily pill. But this treatment is not curative, and the risk of the virus coming back is high if people stop taking their therapy. So it's very important that people take the therapy every day.
So you're saying the drugs aren't curative. Is there a cure for hepatitis B? We'll have the answer to that question in just a moment, but just a quick break to say that if you're enjoying the podcast, why not share it with your family and friends or rate and review on your favourite podcasting app? And now, back to the show.
Well, no, there isn't yet, but look, we're working on it every day. This is what gets me out of bed every day, and there's an incredible amount of work going on in laboratories worldwide, including our own team here at the Doherty Institute, trying to develop new approaches that will cure hepatitis B infection. Ultimately, we want people to be able to take or not have to take a pill every day of their lives long term, that we could have a short, finite cure for hepatitis B infection, similar to what has been developed for hepatitis C. That's what we're working towards.
And you are so passionate about finding a cure for hepatitis B that you co-founded the International Coalition to Eliminate Hepatitis B. Could you tell me a little bit about this program?
Yes, together with colleagues here at the Doherty Institute, but also overseas, particularly in France, we established this global organisation of hepatitis B scientists to bring the scientific community together, but also to work closely with HBV lived experience community to try and fast-track a cure for chronic hepatitis B. The HIV field had a dedicated cure initiative since 2010 through the International AIDS Society, and we realised we had nothing in this sort of space for hepatitis B. So we've brought the global research community together with the HBV lived experience community to try and fast-track a cure for hepatitis B.
And what have been some of the major milestones of your program?
Well, we released the first global strategy for hepatitis B cure in 2019. That was published in one of the Lancet journals. And that was a strategy towards hepatitis B cure that was developed by experts in the field in virology and immunology, with contributions from people with lived experience as well. And recognising that to cure hepatitis B, we're going to have to target the virus, but we're also going to have to probably stimulate the immune responses of people whose immune system isn't working very well to successfully control the virus. One thing that's very important with hepatitis B that I haven't mentioned yet, and why it's so difficult to cure, is that the virus can hide within our cells. Its DNA, if you like, can hide in the nucleus of cells. It's what's called a reservoir. That's not targeted by any current therapy. So that's a major challenge.
Changing tack, you have a paper coming up in the Journal of Hepatology on a potential new treatment for hepatitis B. Can you tell me a little bit more about this research?
Rebecca, we're very excited about this. This is in partnership with Dr. Margaret Littlejohn here at the Doherty Institute and colleagues at the Peter MacCallum Cancer Centre. We have programmed a technology known as CRISPR-Cas13b to target the hepatitis B RNA, which drives the virus replication. And we've shown really promising results. Our PhD student, Laura McCulloch, who's recently passed her PhD, is first author on the paper, and she showed that this CRISPR-Cas13b, effectively it works like a pair of what we call molecular scissors, cutting the RNA that the Hep B needs to replicate, virtually eliminating hepatitis B in our cell culture models.
That sounds amazing, Peter. And what do the findings mean for people living with hepatitis B?
Well, look, these are early findings. These are laboratory findings, but they show the potential of this approach. We're very, very excited about this, and we hope that used in combination with other approaches, that we may eventually be able to cure chronic hepatitis B.
And what are the next steps for your research?
Well, we need to further develop the technology so it can be delivered to people living with chronic hepatitis B. And we're exploring similar delivery approaches as those that have been used to deliver the highly effective COVID-19 vaccines. People may have heard of mRNA and lipid nanoparticles, or LNPs, but we need to do a lot more preclinical studies before we go into clinical trials.
Now, the World Health Organisation's global hepatitis strategy aims to reduce new hepatitis infections by 90% and deaths by 65% by 2030. What do we need to achieve this goal?
Well, we need to identify everybody living with chronic viral hepatitis so that they can be treated and receive the appropriate care they need. It's unfortunately, even now in 2024, only 10 to 15% of people living with chronic Hep B have been diagnosed. So if you're not diagnosed, you're not in care. So we have a long way to go.
What are the major barriers to this?
Well, look, we really need to raise awareness of viral hepatitis and eliminate the stigma that's often experienced by people living with chronic hepatitis B infection through education so that everybody is tested and treated appropriately.
Finally, the Doherty Institute is hosting an event for World Hepatitis Day on Thursday, the 25th of July, in partnership with the Doherty Institute, Hepatitis B Voices Australia and Liverwell. That's open to the public. What can people expect from this event?
Well, a great example of raising awareness of viral hepatitis is indeed World Hepatitis Day, which is held on July 28th every year. This commemorates the birthday of the late Nobel laureate Barrett Blumberg, who actually discovered hepatitis B. This year at the Doherty Institute, we're hosting an event with a strong focus on community, lived experience community. We'll explore current developments in community health action for hepatitis B, but also hepatitis C within Victoria. And we'll have presentations from our local public health units, updates on health reform and implementation programs, and importantly, I think this is really cool, a panel discussion from the perspective of those with lived experience of viral hepatitis. The event, as you said, is open to the public, all are welcome. But registration using Eventbrite is a must, and I think information can be found on the Doherty Institute website.
It sure can. Well, thank you so much for joining me today, Peter.
Thank you, Rebecca.
And thanks to all of you for listening to Infection and Immunity Evidence Explained, a Doherty Institute podcast. To register for the World Hepatitis Day event at the Doherty Institute, please visit doherty.edu.au. That's doherty.edu.au. If there is a specific topic you would like us to cover, please get in touch with us by emailing doherty-media@unimelb.edu.au. That's doherty-media@unimelb.edu.au. If you've enjoyed our podcast, please rate and review on your favourite podcasting app and subscribe if you haven't already. The Doherty Institute is a joint venture between the University of Melbourne and the Royal Melbourne Hospital. See you next time.